Hello, this is Allison, RN, General Medical Unit at the Medical Center.
This is Cindy in the emergency department. I'm sending you Mr. Gomez, a 68-year-old gentleman. He came in with pneumonia and exacerbation of his COPD. His daughter found him on the floor at home where he lives by himself. She said he was unresponsive. He recently lost his wife, and there is a question of alcohol use. His temp is 99.2, pulse 100, respirations 36, and his SAT is 91% on 5 liters of O2 per nasal cannula. His lung sounds are diminished in the bases. He has some occasional rhonchi with wheezes in both the anterior and posterior upper lobes. His cough is productive of a greenish-yellow, tenacious sputum. His blood pressure is 150/94. He denies pain. He appears anorexic, although I don't know if he's had any recent weight loss. He's alert and oriented. I put a saline lock in his left wrist, which flushes fine. He voided 250 of clear yellow urine. He's NPO. His antibiotic has not been given, but he's had 2 albuterol nebulizer treatments. Check the MAR for his meds. We did ABGs, blood alcohol, CBC, chest x-ray, chem and metabolic profile, urine analysis, and culture and sensitivity of his sputum. They're all pending. This is the end of my report. We'll be up shortly.
Okay, thank you. Hello, I'd like to introduce myself. I'm Allison, the registered nurse who will be caring for you. Let me just log into the computer real quick. And I'll need to scan your identification band there. Can I have you state your full name and your date of birth?
Hector Gomez, January 1st, 1943.
Okay, thank you. Mr. Gomez, this probe tests your oxygen saturation. Just goes right on your finger here. I'm going to count your respirations. I'd like to listen to your lungs. Okay, and on the front. Mr. Gomez, your respirations are 15 and I hear crackles in your lungs. Can you tell me the name of the hospital or today's date?
Not the hospital.
Can you tell me the name of the hospital?
I'm just too tired.
Listen again. Okay, let me scan your ID band. Have you state your name and birthday?
Hector Gomez, January 1st, 1943.
Thank you. Mr. Gomez, your provider has ordered you a new medication called ceftriaxone. So I'll go prepare that medication and bring it back when it's ready, and we'll go over everything together. Did Dr. Pizzi tell you that he had written orders and you'll be receiving a soft diet?
Yes, he did. But I'm not very hungry right now.
Well, is there anything else I can do for you in the meantime?
No, I'm okay.
Excuse me. Can you help my dad?
Sure, what does he need?
Well, he's complaining of his skin itching. He says he thinks it's pretty dry. Do you have any lotion he could use?
The counter first, and I'll wash my hands. I'd like to see what's going on.
Oh, good. He'll be glad. He started itching right after you hooked up his antibiotic. I wanted you to know this before it gets any worse.
Well, I'm glad you caught me in the hall. Are you having any breathing difficulty?
No.
Okay. I'm going to turn off your IV medication right away. Okay, scan your ID band and your name and birth date.
Hector Gomez, January 1st, 1943.
Great, thank you. Well, I'm going to go ahead and count your respirations and take the rest of your vital signs, okay? Okay, go ahead and relax your arm. And a temperature. Great. Okay, I'm just going to count your respirations. Okay, thank you. Now, I noticed in your chart that you have an allergy to ampicillin. Some patients who are allergic to this medication may also be sensitive to similar medications. So I'll make a note of this reaction in your medical record and give Dr. Pizzi a call so he's aware. You might want to change your antibiotic. I'm just going to flush your catheter with some saline, okay? I'll need to scan your bracelet again. Your name and birth date?
Hector Gomez, January 1st, 1943.
I'll just put on some gloves and start flushing your IV. How do you feel?
Feeling a little itchy.
Well, I would rather you not scratch or rub your chest or arms, okay? I know that's hard. I'll call Dr. Pizzi about the antibiotic.
You worry about me too much. He shouldn't worry about me that much.
Dad, I can't help but worry. I'm very worried about his being alone. I'm afraid he might get into one of these bad breathing spells and not be able to get to the phone to call me. He's not been coping well since Mom died. I've been trying to get him to quit smoking, and I think he's been drinking too much.
Hey, Jessica. I was just in to see Mr. Gomez. I gave him his albuterol treatment, and I'm concerned about his breathing. His breath sounds seem much more diminished, and he's complaining of pleuritic chest pain and increasing shortness of breath. You might call and see if we can increase the frequency of his treatments, and I don't see a chest x-ray other than the one we got upon admission.
Okay, great. Thanks for letting me know, Dan. I'll go check on Mr. Gomez, and afterwards I'll call and see if we can get an order for another x-ray.
Thanks.
Jessica, I'm glad you called. I looked at the chest x-rays on the computer. He does have a pretty severe pleural effusion. I wrote some new orders. Let's get him ready for a thoracentesis.
Okay. I was hoping that getting him up to the chair and encouraging coughing and deep breathing would be effective, but it didn't do anything for him. Mr. Gomez is fairly good about using his incentive spirometer. I'll go ahead and get informed consent for him to sign and do a few things before the procedure.
Good. I'll go in and talk to him about the thoracentesis. I'll also talk to him about him possibly needing a chest tube. I'll write a new order just in case he needs one.
Okay, great.
How are you doing tonight, Mr. Gomez?
I don't know, I'm having a pain in my side.
Oh.
Kind of having a hard time taking a deep breath.
Oh, let's see. Okay.
Do you think you could turn up my oxygen?
I'm sorry, I can't adjust your oxygen, Mr. Gomez. I will go and get your nurse.
Hello. Can I have you verify your name and date of birth for me, please?
Hector Gomez, January 1st, 1943.
Okay, can I check here?
You know, my side really hurts. It's really hard to breathe. You think you could turn up my oxygen?
Well, first I'd like to take a look at your chest tube, and also I want you to keep using your incentive spirometer like you've been doing, okay? If I could have you roll just a little bit. Your chest tube seems to be working okay. Let me go get you some acetaminophen, and I'll call the respiratory therapist to see if a breathing treatment will help make you feel a little better. Okay.
Oh, is that Mr. Gomez's breakfast tray?
Yes, he just finished eating, and I've marked everything on the intake and output sheet in his room.
Great. Good morning.
Morning.
May I have your name and birth date, please?
Hector Gomez, January 1st, 1943.
Thank you. Mr. Gomez, I saw Maggie in the hall carrying your breakfast tray, and it reminded me that I want to talk about your dietary habits with you today. I'd like to just review your lab test results together and just kind of discuss how you can start making some healthier choices.
Yeah, Maggie's supposed to come over and help me with my bath.
Okay, we can do it later this morning if you'd like.
That'll make my daughter happy. She's been nagging me about my diet, so I know it'll make her happier.
Oh, Mr. Gomez. Oh, my goodness. Oh, Allison, I'm so glad to see you. Mr. Gomez injured his arm.
Glad I got here when I did. And now we're going to review your metered dose inhaler. Do you have any questions on the discharge instructions we've already covered?
No.
How about you, Rosa? Any questions?
No, I'm good. I understand everything.
Okay. Here's the handout on the metered dose inhaler. You might want to glance at it as we watch the video, okay? I'll get the TV up and running.
Meter dose inhalers disperse medication into the lungs through mist, aerosol spray, or a fine powder. Hold the inhaler approximately 1 to 2 inches, that's 2 to 4 centimeters, away from your open mouth. Take a deep breath and then exhale completely. Inhale slowly and deeply as you depress the inhaler completely. Continue breathing in for 3 to 5 seconds. Then hold your breath for approximately 10 seconds. This helps ensure that the medication reaches the lower airways and not just the back of the throat.